Welcome to GatewayC Live, Greater Manchester. Fast facts, supporting earlier and faster cancer diagnosis. Non-site-specific cancer symptoms. Think A to G. Our specialists are Dr. Rishi Sethi and Rebecca Duggan. A. Any concerning symptoms.
Symptoms that may concern you that there's a possible underlying malignancy but which don't fit into a clear 2-week wait tumour-specific pathway. So those can be anything from weight loss, which we quantify as being more than 5% over a sort of 3 months period, decreased appetite, nausea, bloating, a vague abdominal pain, which again generally needs to have been around for around 4 weeks or more, fatigue, night sweats, inguinal lymphadenopathy, malignancy of unknown origin, suggestion on any imaging, but also including GP, patient or family concerns.
B. Blood tests.
In terms of investigations, your blood tests, your basic blood tests are really important. So for blood counts, is the patient anemic? Do we know why that might be? So B12, iron, folate is also really important.
C. CT.
A CT is probably the bedrock of a lot of the investigations. It's quite a good test to exclude cancer, and certainly we pick up a lot of other incidental findings on the CT scan as well, which may sometimes explain some of the symptoms that patients have had. A lot of these patients were getting referred in through 2-week wait, but often there were delays in other pathways. So this is a really good way of kind of coordinating those tests and getting patients early access to imaging, which is absolutely vital for early diagnosis of cancer, but also early exclusion and kind of reassuring patients that don't have a cancer diagnosis. So I think that's a fundamental kind of bedrock of the RDC, especially for the non-site specific pathways. There are areas in a CT scan where pathology can be hidden, so we don't optimize the CT protocol for looking at the colon, for example. So early colonic lesions can be missed on CT scan, and the same with the upper GI tract as well. So the esophagus, the stomach, they're not optimized for assessing on unprepared CT scan. So I think though, if you've got a patient who's got weight loss and still got symptoms, there needs to be some safety netting in place to ensure that ancillary investigations are performed to exclude a cancer diagnosis. But CT broadly is a very, very good baseline test.
D. Don't forget safety netting.
So we would always say that, as far as possible, cancer has been excluded on this pathway. However, we make sure that we're telling patients, if these symptoms worsen or, any other symptoms, that we haven't sort of looked at and discussed in this pathway, please go straight back to your GP. It's not that we've given you some sort of all clear for cancer for the next 2 years or anything like that. We're very clear with patients that, we haven't got to the bottom of their symptoms, particularly from a cancer perspective, but they may need following up on, a non-cancer pathway. So yeah, just very clear about that and document that in our discharge letters as well as verbally to the patients that they need to carry on looking for all the advocated signs and symptoms you would for any other type of cancer.
E. Examination.
I think it probably plays into that kind of GP intuition, doesn't it? If you've seen a patient, and I think that adds a lot more in terms of kind of the referral into the service. But that would be my perspective. We often see a lot of equivocal findings on imaging sometimes, and having some clinical context to those to assign an importance to them, it can be absolutely critical in terms of reassuring patients or referring them on for further investigations. So I do feel that an actual consult is really important and adds lots of additional value.
F. Fecal immunochemical test. FIT.
FIT test is hugely important because if it's done early enough in primary care, we will have that ready and waiting sort of fairly quickly after we triage these patients. Some of these symptoms can indicate obviously a potential bowel cancer, and it's important that we're factoring this into our triage making. So yeah, getting that FIT test done in primary care, it gives us an indicator of how urgently a colonoscopy might need to be performed as part of that overall testing. Especially we get a sort of iron deficient anemia presentations. Anemia is one of the referral symptoms to the NSS pathway, and it's a really good indicator of how urgently we need to proceed to a colonoscopy if a FIT's negative or in fact raised.
G. Greater Manchester Referral Proforma.
So what's really important when they're being referred, patients are being referred via the NSS route, is that the referrer fills the free text box in on the GM referral form, just to give us a bit of narrative and a bit of context on your thoughts around these symptoms, sort of how long they've been there, any other factors that aren't, in that tick box of referral symptoms, just to give us some real good information to go off when the services are triaging these patients and deciding what to do next.
Think A to G.
A. Any concerning symptoms. B. Blood tests. C. CT. D. Don't forget safety netting. E. Examination. F. Fecal immunochemical test. FIT. G. Greater Manchester Referral Proforma.
GatewayC Live, Greater Manchester. Fast facts, supporting earlier and faster cancer diagnosis.